Mac is still tuned in to News and Views. Time is 18 minutes past 9 Central African time. And we're going to be switching gears now to a very, very important conversation. South Africa's national health insurance, the NHI, well, that debate has once again been thrust into the spotlight. This is after a major legal setback involving one of the healthcare system's most controversial provisions, the so-called Certificate of Need scheme. The provision would have essentially given government significant powers over where doctors, nurses, and healthcare practitioners could operate, with officials previously arguing it was central to achieving equitable healthcare access across the country. But despite the courts essentially striking down the measure, government appears defiant. They're insisting that the broader NHI project will continue regardless, unabated. And the latest development have reignited questions around the constitutionality, the feasibility, and just the future of the NHI, as well as whether South Africa can realistically reform healthcare without over-centralizing control of the sector. And to help us unpack the political, legal, and healthcare implications of this latest development, we are joined by health activist and also ActionSA member of parliament, Dr. Kgosi Letlape. Doc, good morning. Thank you so much for joining us. Always a pleasure.
Good morning to you and good morning to the viewers.
No, the pleasure is all ours. And I think we'll jump right into it for our listeners. And I think this is very, very important. If you can just help us understand the significance of this latest court ruling. Why was the certificate of need provision such a central part of government's healthcare strategy and the implementation of the NHI?
Well, they've made it central because they are obsessed with control, not delivery, because it was totally unnecessary and it was a violation of sections of the Constitution that speak to the right to choose your occupation, the right to live where you want, the right to work where you want to. Basic human rights enshrined in the Constitution. And the provisions 36 to 40 violate those rights. This is something that is not new. When I was with the Medical Association, we challenged this. And that is why, at that time, those sections were not promulgated with the rest of the National Health Insurance Act, the National Health Act. And it is now time that the government listens, that the Department of Health in particular listens, that this is not on. And you must also understand that this has major implications in terms of how NHI has been formulated. By their own arguments in court, it was based, certain parts of the NHI were based on this part of the National Health Act, sections 36 to 40, which have now been declared unconstitutional. So basically, we've got to go back to the drawing board. And if this government is serious about health reform, it should bring back the National Health Insurance Act back to Parliament for review in terms of the decision that has been made by the Constitutional Court.
I want to come back to the argument that government lawyers reportedly argued, the fact that controlling where healthcare professionals can practice was crucial for achieving equitable healthcare access. What do you make of that argument? I know the court has struck it down, but what does it say about the constitutional tension surrounding the NHI, as you mentioned, and that argument specifically? Why does it or does it not hold water?
It's basically It doesn't hold water because you got to build a system based on what you have, not on ideology. And what we have as a template for healthcare, what we have as a source for health services for the majority of citizens is the public healthcare system. So if you wanted to achieve universal access, you'd put all your baskets into improving the public healthcare system. That's all that you need to do. So the public healthcare system to serve all of us, rich, poor, pink or blue, white, irrespective of who you are, all citizens would be at the point of service. And that's what you need to do. So what they're trying to do is irrational. And that's why they are so determined to go forward with the NHI. It's got nothing to do with delivery of services, because you're taking the most impossible way of trying to deliver quality, equitable, accessible services. And here's the thing. I don't know why the government thinks you're going to achieve universal access to care by destroying the private healthcare system. If you go back, National Health Act says, it says you're going to improve access to everyone, utilizing public and private service providers. But what chapters 36 and to 40 of the National Health Act were meant to do was effectively to destroy the private health sector. Let me give you an example. The government has control of facilities. They license hospitals. So they control that process. So they could ensure that they give licenses where they deem licenses are necessary. But when it comes to individual healthcare professionals, you have regulatory bodies that ensure that all those healthcare professionals are fit for purpose. Why do you then need a second stage where the government wants to be the one that accredits? They want people to be buying licenses to earn a living from corrupt officials. This is about control. It's not about delivery. And it's about time our government learned that their main function is coordination and regulation, not control and destruction, which is what they are doing right now.
Speaking of the government, despite this very, very, I think, apparent legal setback, they're insisting that the ruling won't stop the NHI. Do you believe the state is almost underestimating, the influence that this ruling might have, and also the scale of the legal and practical resistance that's facing the NHI as a project?
Well, if you go to Section 31 of the judgment, when they were answering affidavits, it reads that the respondents state that the scheme created by the impunged provision is a central pillar in the implementation of the National Health Insurance Act, which, among other objectives, seeks to achieve the progressive realization of the right of access to quality personal health services to realize universal health coverage. This is their own answer, where they are saying those sections are a central pillar in the implementation of national health insurance. Either they were lying to the Constitutional Court with this argument, or they don't know what they are doing. For them to now say this will have no impact, when in their arguments to the Constitutional Court, they stated that it is a central pillar, defies logic. So either you have people that have other agendas and are committed to those agendas, or don't really understand what they are about. In both instances, that's quite sad. So I am not putting words into their mouths. I'm putting the arguments they put to the Constitutional Court in arguing this matter. So you go, read Section 31, their own words. And now they come and say, oh, this has no impact on NHI. What is it? Did they lie in their arguments? Or they don't know what the hell they're doing? That should give us serious concern. I mean, the statement they made post this decision is scary. It's scary to say they actually don't know what they're doing. So as a member of parliament and as a member of the health committee, I'm going to insist that the NHI document be brought back to parliament for scrutiny. because their central pillar has fallen apart.
Supporters of the NHI say, drastic interventions are necessary because I think, as we all know, South Africa's healthcare system does remain deeply unequal. How does one then balance equity with constitutional freedoms and professional autonomy, which is, I think, is very, very essential to what we've been talking about thus far?
I think people should go back to basics. This inequity is driven by the health ministry. This inequity has been signed off by the health minister. People forget that the Medical Schemes Act is an act of parliament sponsored by the Minister of Health. So this inequity that they talk about is created by themselves. And they seem to be unable to make it even work optimally for the people that are on medical aid. Now, this is a bizarre way of trying to build a healthcare system. When one of the areas where you have access, where you have excellence, you think you can build by destroying that component so that you can create mediocrity for everyone. It doesn't make sense. What we need to do is to stop this NHI nonsense. I put it to you, and strengthen and build the public healthcare system so that all of us can use it for no payment at the point of service. Those that are on medical aid are part of the taxpayers of this country. They fund the monies that go to support the public healthcare system. You cannot build a system for all when you are driven by hate for a sector of your community. I am a proponent of a national health system that works, where we will utilize service providers publicly and privately. But what is being envisaged here is to destroy the private sector. Or they'll tell you, oh, we don't want to. But there's a provision in the NHI that says, once the NHI kicks off, what the NHI supplies, nobody can supply. And medical aids will have to change. It's a bizarre provision where you think you're going to build by barring people from making their own personal decisions about their own money, about their own bodies, which is a basic, fundamental human right enshrined in our constitution.
Lastly, before I let you go, Doc, there are also serious concerns that increasing regulation and I think uncertainty within the sector could push more and more doctors and even specialists out of the public system or even out of the country entirely. How serious is that risk and that concern?
You know, that is a choice for individuals to make. Let me give you an example. When I qualified in 1988, I was basically made persona non grata in the public healthcare system. What did it mean? It meant that I either go into private or I immigrate. I chose to stay and I went to private. Currently, we have young doctors that qualify and can be absorbed into the public healthcare system. If you destroy the private sector, what's the other choice? Is to leave the country. So that is just simple logic. That's simply what is going to happen. That is the lived reality of newly qualified healthcare professionals and seasoned healthcare professionals. Remember, what people don't realize is that this is not just about a newly qualified doctors. What the provisions were that have been taken out by the Constitutional Court was that, for example, if in Soweto you had 100 GPs and the minister and the GG decided, no, we only need 40, it means the 60 must die. They are only going to accredit 40, and the other 60, they are not entitled by law to earn a living, where they've earned a living for their whole life. And they've got to make a decision of where to go. Also, the certificate of need had a 20-year life expectancy. In 20 years, it ends. I was in private practice for nearly 40 years. So that meant after 20 years, I could be taken out by a minister or a DG, where they say your certificate of need has expired. And in terms of the law, 20 years is the maximum. It's absurd. It's absurd. What are you trying to achieve? We cannot build this country on hate. And what has driven this piece of legislation is hatred for private provision of healthcare.
We're going to do on that note, Dr. Kgosi Letlape, health activist and member of parliament for ActionSA. Always a pleasure chatting to you. Really appreciate your time. Thank you so much, sir.
Thank you for the opportunity.
There we go. And with that, we're going to take a quick break. News and views will continue after this.
Families. It may be the